Hi, I'm Danny Williams. This is my patient Marshall. So she's currently suffering from low back pain. And so I'm going to show you guys a treatment that you can do in order to treat this low back pain. And this is called low frequency TENS using interferential current. So essentially what you do is you set up your patient like so. You're going to have them lying prone with their lumbar back exposed. And what I do is I have 4 electrodes and they are placed along the paraspinal muscles. And because of the electrodes that we have, we're using cuff weights in order to keep them down so they have direct contact with the skin. And so the purpose of this is what you're doing is you're blocking pain impulses from reaching the brain at the spinal cord level. So using this current, essentially what you do is you stimulate the release of beta endorphins, which bind to receptors in the brain and in the spinal cord. And it also causes the release of corticosteroids in your body naturally, which is just a natural anti-inflammatory in your body. So as you can see, we have our setup here and we have all of our parameters set up. Before you start your treatment, you want to check for safety, so make sure that there's no frays in the cords or the wires. And then also, as we already know, Marshall has low back pain, so that's an indication for this treatment. But before I start her, I would make sure I cross off any contraindications or any precautions. So I would be sure to ask Marshall if she has any history of cancer, any history of heart problems, any pacemakers. I would also ask if she has altered skin sensation anywhere. And then other things you could check for is what kind of medications they take. Like if they take prednisone, for example, you need to be cautious with this form of treatment. But yeah, so we've already had this discussion, so we're good to go. So Marshall, I'm going to start turning up the amplitude here, and I just want you to tell me when you can feel the sensation. It's just going to be like a light tingling, but it shouldn't be painful or uncomfortable, okay?
Okay.
Okay. Okay. So I'm going to keep turning it up, and I want it to get to the point where you feel kind of a grabbing sensation
Okay.
along those muscles in your lower back. But again, if it's too much or if it's painful, just let me know, okay?
Yeah.
Right there? Okay, so what we do is just leave her set up like this for 30 minutes, relax, hang out. Another thing using low frequency TENS is that this form of treatment, according to literature, has been proven to have a longer lasting pain relief effect. So if we went for 30 minutes, they should be expected to have at least 30 minutes of pain relief following this treatment.